Hey everyone, and welcome back for another deep dive. Today we're going to be looking at something that I'm sure we've all dealt with a lot over the years.
Yeah.
And I know I certainly have
Yeah.
upper respiratory tract infections.
URTIs, or as we all know them.
URTIs, those sniffles and coughs and sore throats,
Yeah.
that just always seem to hit us at the worst possible times. And of course, we can't forget about the one that really kind of changed everything a few years ago,
Yeah.
COVID-19.
COVID. Yeah.
And you sent me a really interesting mix of sources this time, including information about this really unique approach to dealing with these infections from Dr. Hassan Al Warraqi.
Yeah. It's fascinating to see how URTIs, despite being so common, they can really range from just a minor inconvenience to a really serious health concern.
Yeah.
So it's definitely something that we all need to be aware of. And Dr. Al Warraqi's approach with a focus on things like honey and fasting adds a really unique element to the conversation.
It does. It's like we all kind of know what a cold feels like, but it's like there's always more to learn.
Yeah.
Right.
Always more to learn. Absolutely.
So let's break this down.
Yeah.
First things first, what exactly are URTIs?
Okay, so URTIs, as the name suggests, they're infections that affect the upper part of your respiratory system.
Okay.
So that's going to be your nose, your throat, your sinuses, basically everything above the chest. And most of the time, they're caused by viruses. But sometimes, bacteria can also be the culprit.
Okay, and what about the symptoms? I mean, we've all been there. The runny nose, the cough.
Yeah.
That feeling like you swallowed sandpaper. Is there anything else we should be watching out for?
You pretty much got it. The classic lineup there. But the thing is that you really have to pay attention to how you feel.
Okay.
So if you've got a high fever, that just won't break after a few days. If you have trouble breathing, a really severe sore throat that makes it difficult to swallow, or any symptoms that are just kind of getting worse instead of better, that's when you really want to get checked out by a doctor.
Yeah. Solid advice. Now, speaking of things that kind of shook up the world, I think we have to mention COVID-19.
We do.
We all got a crash course in virology the last few years.
You really did.
So in your expert opinion, what did COVID-19 teach us about these infections?
Well, COVID-19, which is caused by the SARS-CoV-2 virus, it really threw us all for a loop.
Yeah.
This global pandemic, impacted almost every aspect of our lives. And the emergence of all these new variants like alpha, beta, gamma, Delta, Omicron, it just kept us all on our toes.
Yeah, it really felt like a whirlwind. And even though there were a lot of symptoms that overlapped with other URTIs, there were definitely a few unique ones, like that whole loss of taste and smell.
You're right. And that was a big one for a lot of people, along with the more common symptom, like a cough, fever, fatigue. And, some people even experienced some gastrointestinal issues.
Yeah.
But sadly, we also saw that certain groups were more vulnerable to severe illness, like older adults, people with underlying health conditions, and those with weakened immune systems.
Right. And then there was that whole testing saga.
Oh, yeah.
It was like we were all trying to figure out what the difference was between a PCR test, an antigen test, and an antibody test.
Right. It was a lot to keep track of. PCR tests were the gold standard for accuracy, but they did take a while to process. Antigen tests were much faster, but sometimes they weren't quite as sensitive. And then you had the antibody tests, which helped us understand past infections. It was a very, rapidly evolving landscape.
It was. And then came the treatments. What did the medical world have up its sleeve for this?
So it really depended on the severity of the case.
Okay.
Mild cases were often managed like any other URTI, rest fluids, maybe some over-the-counter meds to ease fever or aches. But for the more serious cases, there were some really powerful tools available.
Like those antiviral medications we kept hearing about.
Exactly. So antiviral medications like Paxlovid and remdesivir, they kind of entered the scene, along with anti-inflammatory drugs like dexamethasone, which, helped people who were really struggling to breathe. And of course, in the most critical cases, oxygen therapy and ventilators became absolutely crucial.
Wow. It's amazing how quickly the medical community mobilized to address the crisis.
It really is.
But even with all the progress, there are still some lingering questions, especially when it comes to long COVID.
Long COVID, yeah.
It's like the pandemic shadow.
In a way, yes. It's a very complex and evolving area of research. We're still piecing together the puzzle. Lingering symptoms like fatigue, brain fog, joint pain, persistent cough are all too common. And then some people experience even more unusual symptoms, what doctors sometimes call unexplained complaints.
It really underscores the fact that there's just so much we don't know about how viruses impact the human body, even long after the initial infection is gone. And this is what brings us to a different perspective on treating these infections. That really caught my eye in the sources you sent over.
Dr. Al Warraqi's approach.
Yes, his approach focusing on things like honey and fasting. It's a different spin on things.
Very different.
Very intriguing.
So let's dive into Dr. Al Warraqi's world. First up, honey. I mean, we all love honey on toast or in our tea. But he's claiming that it's like a secret weapon against infections. What's the science behind that?
Well, honey actually has a very long history of being used for its medicinal properties.
Okay.
It's naturally antimicrobial and anti-inflammatory, which could explain why it's been a go-to for soothing sore throats for centuries.
That makes sense. But Dr. Al Warraqi takes it a step further, right?
He does.
He's recommending gargling with honey, even applying it topically.
You're right. He suggests gargling with honey to kind of coat and soothe the throat and potentially reduce the number of bacteria in the mouth. And then he also believes that applying honey topically can help cleanse those nasal passages.
Okay.
Removing irritants and possibly even fighting off infection. Yeah. Okay, so that's definitely a new one for me. It's like using honey's natural properties to support the body's own defenses.
Exactly.
And then there's fasting, which seems even more surprising. What's the connection there?
Well, Dr. Al Warraqi sees fasting as a really powerful way to kind of boost the immune system and reduce inflammation. He's a proponent of, various forms of fasting, including intermittent fasting and the traditional Islamic practice of fasting during Ramadan.
So the idea is that by giving your digestive system a break, your body can focus its energy on other things, like strengthening your immune response.
Exactly. It's like hitting the reset button, allowing your body to dedicate more resources to fighting off infection and repairing itself.
That's fascinating. It really challenges the idea that you need to be constantly fueling up when you're sick. But he doesn't stop there, does he?
No, he doesn't.
He's also big on these cleansing rituals.
He emphasizes, thoroughly cleansing the mouth, the nose, and sinuses to both treat and prevent infections. And we've already talked about the honey gargles, but he also recommends saline rinses to flush out irritants and potentially harmful microbes.
So it's like a multi-pronged approach.
Yeah.
Boosting your immune system with honey and fasting, but at the same time actively cleansing your respiratory system to remove any potential threats.
Precisely.
And it's all part of this larger philosophy of, taking a proactive approach to health.
Yes.
Rather than just waiting for things to go wrong.
Exactly.
I like that.
Yeah.
So we're talking about more than just treating the symptoms here. What other lifestyle factors does he emphasize?
Well, he's a big advocate for minimizing exposure to allergens.
Okay.
Which, when you think about it, it makes sense.
Oh, yeah.
Allergens, they trigger inflammation, which can make you more susceptible to infection.
Right. So it's like setting your body up for success.
Exactly.
By just reducing those potential triggers. Does he talk about any other natural remedies besides honey?
He does mention a few others.
Like getting enough sun exposure, cold water therapy, and regular exercise.
Yeah.
He sees those as ways to kind of strengthen your body's natural defenses.
So it sounds like he's encouraging us to view our health as like an ongoing project.
Yes.
Something that we actively participate in, rather than just passively waiting for things to go wrong.
Exactly. And it's a journey that you're already on. Constantly learning and adapting.
Right.
And the pandemic, it really brought this to the forefront, didn't it?
It did. We all had to reevaluate our health habits. From basic hygiene like hand washing and using sanitizers to things like mask wearing and social distancing.
Right.
Especially in, crowded or poorly ventilated spaces.
Exactly.
It's interesting how all of those measures, which were primarily about preventing the spread of COVID-19, probably had this ripple effect on other URTIs too.
Yeah.
Remember how flu cases seemed to drop significantly during those peak pandemic years? It just goes to show you how even simple changes in behavior can have a really big impact on our health, both individually and collectively.
Right. But even with all the preventative measures in the world, we're still going to get those pesky URTIs sometimes.
Oh, we are.
And sometimes rest and fluids just aren't enough. So that's where those targeted treatments come in, right?
Exactly.
So for your typical cold or sore throat, over-the-counter medications like paracetamol or ibuprofen can help manage fever and aches.
Right.
But for more serious cases like COVID-19, we've seen some incredible advancements in the medical world.
We have. Antivirals like Paxlovid and remdesivir have really been game changers. And anti-inflammatory drugs like dexamethasone have played such a crucial role in helping people breathe easier. And let's not forget the the incredible impact of vaccines,
Yeah.
especially during the pandemic. Companies like Pfizer, Moderna, Johnson & Johnson, AstraZeneca, Novavax, along with all the regional variations around the world, really stepped up to the plate.
It is amazing to think about how vaccine technology has advanced. But even with all these tools at our disposal, there's still the shadow of long COVID, reminding us that we don't have all the answers yet.
It's true.
It's this web of persistent symptoms, from fatigue and brain fog to those more unusual, unexplained complaints. It really highlights how much we still have to learn about this complex relationship between viruses and the human body.
Right.
Which brings us back to Dr. Al Warraqi and his unique approach. Now, he's not saying ditch conventional medicine, is he?
No, not at all. It's more about exploring how these natural practices might complement existing treatments or even play a role in preventing these infections in the first place.
Okay.
It's about adding tools to our toolbox, not throwing any of them away.
I like that analogy. So what does all this mean for our listener? For the everyday person who's trying to navigate this world of URTIs and stay healthy, what are the key takeaways from this deep dive?
Well, I think the first takeaway is simply awareness. URTIs, they're a part of life. We're all going to encounter them. But, understanding the different types, recognizing the symptoms, and knowing when to seek medical attention can make a huge difference.
Absolutely. And when it comes to treatment, we've seen that there's a whole spectrum of options available, from conventional medications to these natural remedies. It's about finding what works best for you, in consultation with your doctor, of course.
Of course. And Dr. Al Warraqi's approach, it reminds us that it's not just about treating the symptoms. It's also about cultivating overall well-being. Incorporating things like honey fasting and other natural practices can really support your body's natural defenses.
Yeah.
And help you take a more proactive approach to your health.
I love that. Proactive. It's about empowering yourself, taking an active role in your own health journey.
Exactly. And that journey is constantly evolving, especially as we face, new challenges like long COVID. There's still so much to learn and discover.
That's right. Which leads us to our final thought-provoking question for our listener. Considering everything that we've explored today, the advancements in medicine, the potential of natural remedies, and the ongoing research into long COVID, how might we approach health and well-being in the future?
That's a really good question.
It is. It's something to ponder. And if you're interested in learning more about Dr. Al Warraqi's approach, we've provided links to his website and a really fascinating YouTube video where you can kind of delve deeper into his methods.
Awesome.
Remember, it's always a good idea to explore different perspectives.
And form your own informed opinions.
Absolutely. And this is just one deep dive into a vast ocean of knowledge.
Right.
There are so many more fascinating topics to explore, so many more intriguing mysteries to unravel.
Exactly so. Until our next deep dive, keep those curious minds engaged. Keep asking those insightful questions. And keep exploring the wonders of the world around us.
I love it. Thanks for joining us on this incredible journey of discovery. It really is amazing to think about all the different pieces, that we've kind of explored today. From the science behind all of this, to the potential of both conventional and natural approaches, it really highlights just how complex health is.
Yeah.
And how much we're still learning.
It really is a constant journey of discovery.
It is.
And it's so exciting to see, how all the new research and these different perspectives are really shaping, our understanding of how to stay healthy.
They are. And for our listener out there, who's been diving deep with us today, we've included links to Dr. Al Warraqi's website and a really interesting YouTube video where you can explore his approach a little bit more in detail. It's definitely worth checking out.
Oh, yeah.
Even if it just, sparks some new ideas or questions.
Absolutely. Always good to keep those curious minds engaged.
Exactly. And remember, this is just one deep dive into a vast ocean of knowledge.
That's right.
We have so many more fascinating topics to explore together. So many more rabbit holes to jump down.
I can't wait.
Me too. So until then, keep those curious minds buzzing. Keep asking those insightful questions. And keep exploring this amazing world around us. Thanks for joining us on this incredible journey of discovery.